Good day, everyone. My name is Noveline S. Soloris, and my report is all about clinical and counseling assessment. For our introduction, we are going to define clinical and counseling psychology. Clinical psychology is a branch of psychology that has as its primary focus the prevention, diagnosis, and treatment of abnormal behavior. Clinical psychologists receive training in psychological assessment and psychotherapy and are employed in hospitals, public and private mental health centers, independent practice, and academia, while counseling psychology is a branch of psychology that is concerned with the prevention, diagnosis, and the treatment of abnormal behavior. Furthermore, clinical psychologists tend to focus their research and treatment efforts on the more severe forms of behavior pathology, whereas counseling psychologists focus more on everyday types of concerns and problems, such as those related to marriage, family, academics, and career. Now, clinical assessment may be undertaken for various reasons and to answer a variety of important questions. For the clinical psychologist working in a hospital, clinic, or other clinical setting, tools of assessment are frequently used to clarify a psychological problem, make a diagnosis, and or design a treatment plan. Now, atypical questions that require answers are: does this patient have a mental disorder? And if so, what is the diagnosis? Now, in many cases, tools of assessment, including interview, a test, and a case history data, can provide those answers. Now, before or after interviewing a patient, a clinician may administer tests such as Wechsler Intelligence Test and the MMPI-2RF to obtain estimates of the patient's intellectual functioning and level of psychopathology. Now, the data derived may provide the clinician with initial hypotheses about the nature of the individual's difficulties, which will then guide the interview. Interview, on the other hand, and test data will be supplemented with case history data, especially if the patient will not or cannot cooperate. The clinician may interview people who know the patient, such as family members, co workers, and friends, and obtain records relevant to the case. Ideally, case history data will provide some way to estimate the patient's level of premorbid functioning, meaning before illness or disorder. On the other hand, we have some tools of assessment that can help guide decisions relating to treatment. The first one is: what type of treatment shall this patient be offered? Now, for instance, patients found to be high in intelligence tend to make good candidates for insight oriented methods that require high levels of abstract ability. Second one is: how can this person's personality best be described? Gaining an understanding of the individual need not focus on psychopathology. People who do not have any mental disorder sometimes seek psychotherapy for personal growth or support in coping with a difficult set of life circumstances. In such instances, interviews and personality tests geared more to the normal test taker might be employed. Researchers may raise a wide variety of assessment related questions, including which treatment approach is most effective, or what kind of client tends to benefit most from a particular kind of treatment. Now, the researcher would use a variety of assessment tools to combine subjects into treatment groups and then to measure outcome in psychotherapy. Moreover, counseling psychologists who do employment counseling may use a wide variety of assessment tools to help determine not only what occupations a person might enjoy, but also which occupations would be sufficiently challenging yet not overwhelming. An objective of clinical assessment is to diagnose mental disorders. Now, the reference source used for making such diagnosis is the current version of the American Psychiatric Association, which is the DSM-4-TR. The diagnoses are descriptive and theoretical. Now, this is appropriate for an authoritative reference work designed to provide common language for clinicians and researchers with a varied theoretical orientations toward the etiology and treatment of mental disorder. Biopsychosocial assessment, on the other hand, is a multidisciplinary approach to assessment that includes exploration of relevant biological, psychological, social, cultural, environmental variables for the purpose of evaluating how such variables may have contributed to the development and maintenance of a presenting problem. Now, among their findings, was that a high degree of fatalism, that is, the belief that what happens in life is largely beyond a person's control. Now, researchers tried to get the big picture view of this common physical ailment in terms of variables such as self efficacy. It is the confidence in one's own ability to accomplish a task, and social support, expressions of understanding, acceptance, empathy, love, advice, guidance, and so forth in one's social environment. They found that keeping a diary was a useful tool for keeping track of a variety of variables, ranging from relaxation exercises to a standardized measure of spiritual coping strategies. Now, an interview is likely to be part of every clinician's or counselor's individual assessment, except in rare circumstances, such as when an assessee is totally non-communicative. Now, in clinical situation, an interview may be conducted to arrive at a diagnosis to pinpoint areas that must be addressed in psychotherapy or to determine whether an individual will harm himself or others. While for counseling application, an interview is conducted to help the interviewee learn more about himself or herself, the better to make potentially momentous life choices. Now, interviews are frequently used on early on in independent practice settings to solidify therapeutic contract. Now, therapeutic contract, it is an agreement between client and the therapist setting forth goals, expectations, and mutual obligations with regard to a course of therapy. Seasoned interviewers endeavor to create a positive, accepting climate in which to conduct the interview. They may use open-ended questions initially and then closed questions to obtain specific information. Now, the effective interviewer conveys understanding to the interviewee verbally or non-verbally. Ways of conveying that understanding include attentive posture and facial expression, as well as frequent statements acknowledging or summarizing what the interviewee is trying to say. Now, interviews may be typed with respect to a number of different variables. One such variable is content. The content of some interviews, such as general getting to know you interview, can be wide ranging. By contrast, other interviews focus narrowly on particular content. Now, another variable on which interviews differ is structure. A highly structured interview is one in which all the questions asked are prepared in advance. In an interview with little structure, few or no questions are prepared in advance, leaving interviewers the freedom to delve into subject areas as their judgment dictates. Now, an advantage of a structured interview is that it provides a uniform method of exploration and evaluation. In addition to content and structure, interviews may differ in tone. In one type of interview, while not very common, the interviewer intentionally tries to make the interviewee feel stressed. Stress interview is the general name applied to any interview where one objective is to place the interviewee in a pressured state for some particular reason. The stress may be induced to test for some aspect of personality such as aggressiveness or hostility that might be elicited only under such conditions, or screening for work in the security or intelligence fields might entail stress interview if a criterion of the job is the ability to remain cool under pressure. Now, the source of the stress varies as a function of the purpose of the evaluation. Possible sources may emanate from the interviewer as disapproving facial expressions, critical remarks, condescending reassurances, relentless probing, or seeming incompetence. Now, interviewee state of consciousness is another variable related to interview type. Most interviews are conducted with the interviewee in an ordinary, everyday, waking state of consciousness. However, a particular situation may call for a very specialized interview in which the state of consciousness of the interviewee is deliberately altered. A hypnotic interview is conducted while the interviewee is under hypnosis. Now, hypnotic interviews may be conducted as part of the therapeutic assessment or intervention when the interviewee has been an eyewitness to a crime or related situations. While cognitive interview, rapport is established and the interviewee is encouraged to use imagery and focus retrieval to recall information. If the interviewee is an eyewitness to a crime, he or she may ask to shift perspective and describe events from the viewpoint of the perpetrator. Much like what typically occurs in hypnosis, a great deal of control of the interview shifts to the interviewee. Now, and unlike many police interviews, there is an emphasis in open ended rather than closed questions, and interviewees are allowed to speak without interruption. Now, for the collaborative interview, it allows the interviewee wide latitude to interact with the interviewer. It is almost as if the boundary between professional assessor and lay assessee has been diminished, and both are participants working together, collaborating on a common mission of discovery, clarification, and enlightenment. Now, a parallel to the general physical examination conducted by a physician is an interview conducted by a clinician called mental status examination. Now, this examination used to screen for intellectual, emotional, and neurological deficits typically includes questioning or observation with respect to each area, such as appearance, behavior, orientation, memory, sensorium, psychomotor activity, state of consciousness, affect, mood, personality, thought content, thought process, intellectual resources, insight, and judgment. Now, a mental status examination begins the moment the interviewee enters the room. The examiner takes note of the examinee's appearance, gait, and so forth. Now, the orientation is assessed by straightforward questions such as, "What is your name?" or "Where are you now?" and "What is today's date?" As a result of a mental examination, a clinician might be better able to diagnose the interviewee if, in fact, The purpose of the interview is diagnostic. The outcome of such an examination might be, for example, a decision to hospitalize or not to hospitalize, or perhaps a request for a deeper level psychological or neurological examination. Now we'll move forward with the battery of tests. Test battery is referring to a group of tests administered together to gather information about an individual from a variety of instruments. Now, personality test battery refers to a group of personality tests. The term projective test battery also refers to a group of personality test, though this term is more specific because it additionally tells us that the battery is confined to projective techniques such as the Rorschach, the TAT, and figure drawings. Now, standard battery is referred to a group of tests including one test or one intelligence test, at least one personality test, and a test designed to screen for neurological deficits. Now, culturally informed psychological assessment is an approach to evaluation that is keenly perceptive of and responsive to issues of acculturation, values, identity, worldview, language, and other culture related variables as they may impact the evaluation process or the interpretation of resulting data. Now, the misspelled addressing is an easy to remember acronym, wherein A stands for age, D for disability, R for religion, E for ethnicity, S for social status, including variables such as income, national origin, and gender, or occupation and education, sexual S, another S for sexual orientation, I for indigenous heritage, N for national origin, and G for gender. Now, how this addressing acronym be helpful in the assessment of clients? For example, how might a particular disability affect one's worldview in a particular context? Or why might a deeply religious person feel strongly about a particular issue? So these are the types of questions that could be raised by considering the addressing acronym in the assessment of clients. Now, managed care. Managed care is a healthcare system wherein the products and services provided to patients by a network of participating healthcare providers are mediated by an administrative agency of the insurer that works to keep costs down by fixing schedules of reimbursement to service providers. Now, for this reason, any overview of contemporary clinical assessment would be incomplete without reference to managed care and the profound effect it has exerted on the way that clinical assessment is conducted. Now, assessment for drug addiction and for alcohol and substance abuse has become routine in a number of settings, whether an individual is seeking outpatient psychotherapy services, being admitted for inpatient services, or even seeking employment. Being screened for drug abuse or drug use may be prerequisite. Now, a number of tests and scales have been developed to assist in the assessment of abuse and addiction. First one is the MMPI 2RF. It contains three scales that provide information about substance abuse potential. A number of other tests focus on various aspects of drug abuse: addiction potential scale, the addiction acknowledgement scale, and the addiction severity index. It is one of the most widely used tests in the substance abuse field, with the applications to intake evaluations and follow ups as well as the identification of patient subgroups in research. All right. Now, the word forensic means pertaining to or employed in legal proceedings, and the term forensic psychological assessment can be defined broadly as the theory and application of psychological evaluation and measurement in a legal context. Now, psychologists, psychiatrists, and other health professionals may be called on by courts, corrections and parole personnel, attorneys, and others involved in the criminal justice system to offer expert opinion. With respect to criminal proceedings, the opinion may concern an individual's competency to stand trial or his or her criminal responsibility, that is sanity, at the time a crime was committed. With respect to civil proceeding, the opinion may involve issues as diverse as the extent of emotional distress suffered in a personal injury suit, the suitability of one or the other parent in a custody proceeding, or the testamentary capacity, which is the capacity to make a last will and testament of a person before death. Now, it is important to note that there are major differences between forensic and general clinical practice. The biggest difference is that in the forensic situation, the clinician may be the client of a third party such as a court and not of the assessee. This fact, as well as its implications with respect to issues such as confidentiality, must be made clear to the assessee. Another difference is that the patient may have been compelled to undergo assessment. Now, competence to stand in trial. It has to do largely with a defendant's ability to understand the charges against him and assist in his own defense. A defendant must have sufficient present ability to consult with his lawyer with a reasonable degree of rational and factual understanding of the proceedings against him. This understand and assist quote unquote requirement is in effect an extension of the constitutional prohibition against trials in absentia. Now, absentia is a defendant must be not only physically present during the trial, but mentally present as well. Now, persons who are mentally retarded, psychotic, or suffering from a de- deliberate, debilitating neurological disorder are persons held to be incompetent to stand trial. However, it cannot be overemphasized that any one of these three diagnoses is not in itself sufficient for a person to be found incompetent. Stated another way, it is possible for a person to be mentally retarded, psychotic, or suffering from debilitating neurological disorder, or all three, and still be found competent to stand trial. Now, the person will be found incompetent if and only if she is unable to understand the charges against her and is unable to assist in her own defense. That is the only time that the person is incompetent to stand in trial. Now, emotional injury or psychological harm or damage is a term sometimes used synonymously with the mental suffering, pain in the suffering, and emotional harm. In cases involving charges as discrimination, harassment, malpractice, stalking, and unlawful termination of employment, psychological assessors may be responsible for evaluating alleged emotional injury. Excuse me. Profiling may be defined as a crime-solving process that draws upon psychological and criminological expertise applied to study of crime scene evidence. Now, at the core of profiling is the The assumption that perpetrators of serial crimes, usually involving murder, some sort of ritual or other sexual violation, leave more than physical evidence at a crime scene. They leave psychological clues about who they are, personality traits they possess, and how they think. Now, the hope is that these behavior related clues will help investigators effect an arrest. Now, let's move forward with the custody evaluation. Custody evaluation is a psychological assessment of parents or guardians and their parental capacity and or of children and their parental needs and preferences, usually undertaken for the purpose of assisting a court in making decision about awarding custody. Well, ideally, one important expert, one impartial expert in the mental health field should be responsible for assessing all family members and submitting a report to the court. The evaluation of parental capacity typically involves a detailed interview that focuses primarily on various aspects of child rearing, though tests of intelligence, personality, and adjustment may be employed if questions remain after the interview. Now, the court will be interested in knowing whether the child in custody proceeding has a preference with respect to the future living and visitation arrangements. Now, some methods that can be useful in assessing child's parental preference include structured play exercises with dolls that represent the child and other family members, figure drawings of family members followed by storytelling about the drawings, and the use of projective techniques such as the TAT and the related test. Specifically, constructed sentence completion items can also be of value in the assessment of parental preferences. Now, for abuse, it refers to the creation of conditions that may give rise to abuse of a child, a person under the state defined age of maturity, by an adult responsible for the care of that person. Now, the abuse may be in the form of first, the infliction or allowing of infliction of physical injury or emotional impairment that is non-accidental. Second, the creation or allowing the creation of substantial risk of physical injury or emotional impairment that is non-accidental. Or the third, the committing or allowing of a sexual offense to be committed against a child. While the third one is neglect, it refers to a failure on the part of of an adult responsible for the care of a child to exercise a minimum degree of care in providing the child with food, clothing, shelter, education, medical care, and the supervision. Now, the physical signs that may or may not indicate neglect include dress, that is inappropriate for the season, poor hygiene, and lagging physical development. In young children, physical signs that may or may not indicate sexual abuse include difficulty in sitting or walking, itching or reported pain or discomfort of genital areas, stained, bloody, or torn underclothing. Now the find sorry. Now the finding that On the other hand, the finding that people tend to accept vague personality descriptions as accurate descriptions of themselves is called Barnum effect. So, Miel suggested that the term Barnum effect um, be used to stigmatize those pseudo-successful clinical procedures in which personality descriptions from tests are made to fit the patient largely or wholly by virtue of their triviality. Now, we're going to define or differentiate clinical prediction and mechanical prediction. Clinical prediction refers to the application of a clinician's own training and clinical expertise or experience rather as a determining factor in clinical judgment and actions. Clinical prediction relies on clinical judgment, while mechanical prediction or the application of empirically demonstrated statistical rules and probabilities as well as computer algorithms to the computer generation of findings and recommendations. Now, in some studies, the two approaches to assessment seem to be about equal in accuracy. However, Grove concluded that the mechanical approach was about 10% more accurate than the clinical approach. The clinical approach fared least well when the predictors included clinical interview data. Perhaps this was so because, unlike computer programs, human clinicians make errors in judgment. For example, by failing to take account of base rates or other statistical mediators of accurate assessment. Now, the researchers also hinted that that the cost of mechanical prediction probably was less than the cost of clinical prediction because the mechanical route obviated the necessity for highly paid professionals and team meetings. All right, that's all for my report, and thank you for listening.